Hi, and thanks again for tuning in to another episode of Raw Doc TV. I'm Dr. Kurt Tyson, and today we're talking about multivitamins. We've been hearing in the news lately that multivitamins are useless and don't protect against disease. So today we're going to talk about how those headlines are true yet misleading. Multivitamins may not prevent disease, but the right vitamins at the right dosage does prevent disease.
When we look at the ingredients in a typical multivitamin, such as the one seen here, we see that one tablet can provide 100% of the daily recommended allowance for most of the vitamins our body needs. So we believe that just one pill per day with a pretty good diet will give us all the nutrients our body needs to be healthy. But when we look at the medical science behind this, it could be further from the truth. After reviewing study after study, we find that the daily recommended allowance for most vitamins isn't enough to prevent the development of most diseases. In this study here, we look at the effects of B vitamins on preventing Alzheimer's disease-related brain atrophy. They found that by giving patients 0.8 milligrams of folic acid, 20 milligrams of B6, and 0.5 milligrams of B12, there was a significant reduction in brain atrophy versus patients who were receiving a placebo. Now, when you look at the dosage levels of B vitamins given in the study versus B vitamins in the standard multivitamin, the investigators were giving the patients 40 times more folic acid, 10 times more B6, and over 80 times more B12 than what you would find in an average multivitamin. And this goes on. In the next study we look at the effects of vitamin D on preventing type 1 diabetes. They found that by giving a child 2,000 IUs of vitamin D daily during the first year of life, resulted in a 78% reduction in developing type 1 diabetes versus a child who was not supplemented with vitamin D. Wow, that's incredible. But the problem is, when you look at the dosage in a standard multivitamin, it's only 400 IUs. So to get these beneficial effects of vitamin D, the investigators had to give them 5 times the amount that you will find in a typical multivitamin.
Not only is the dosage of a typical multivitamin too low, but there's so many factors that affect the absorption of multivitamins. See, multivitamins are absorbed through the process known as digestion.
In the stomach, food is broken down by mixing it with acids and enzymes to form a liquid which is called chyme. People who have reduced stomach acid or are taking proton pump inhibitors such as Prilosec or Nexium have a reduced ability to break down food, which inhibits the amount of nutrients available for absorption. After leaving the stomach, the chyme enters into the small intestines and is mixed with bile from the gallbladder. The small intestines is where absorption of nutrients takes place. Nutrients then pass through the walls of the intestines and are carried up through the portal vein to the liver, where nutrients are processed and stored. A normal liver is a bright red in color. Drinking alcohol affects the liver in the processing and storage of nutrients, which can cause people to be deficient. The liver can also turn a pale whitish color due to a condition called fatty liver disease, in which excess fat build up in the liver. It is often found in people with central obesity, in which fat accumulates around the organs such as the liver, pancreas, and intestines. This fat is called visceral fat and is different from subcutaneous fat, which is just underneath the skin. The foods we eat also affects our absorption of nutrients. Eating certain foods can irritate the walls of the small intestines and disrupt regular bowel habits, and this is known as irritable bowel. As you can see, disruption in the stomach, gallbladder, liver, pancreas, or intestines can all lead to a reduction in the amount of nutrients being absorbed.
So the reason that multivitamins aren't working is because the dosage that your body is actually receiving is too low to make a difference.
And increasing the dosage of a multivitamin can also make you sick, so that isn't the answer either. The best thing to do is to find out what vitamins and nutrients you are deficient in and replenish them with the appropriate form and dosages. Vitamins are important to prevent disease complications, and to reverse disease. In my practice, I see the most improvement in patient conditions when we give vitamin and nutrients intravenously, because they are able to safely receive higher dosages and the nutrients are delivered directly into the bloodstream without worrying about the many digestive issues that affect absorption in many of us. So skip spending money on a multivitamin. Talk with a healthcare professional who can accurately identify the nutrients you need to be healthy, and consider a nutrient IV replenishment.